Hey everybody, my name is Matt Nash. Good to see some familiar faces. I have a variety of different hats at Duke. Since I'm in Gross Hall, I'll start with the Innovation Entrepreneurship Initiative, where I'm the Managing Director for Social Entrepreneurship. For those of you who aren't familiar with INE, we're a university-wide initiative. We're associated with the Provost's office as part of the capital campaign that Duke is undertaking right now. We're trying to raise about $100 million for innovation and entrepreneurship. So for education, research, translation, social innovation and entrepreneurship. My Catherine Black and I work in the social innovation and entrepreneurship pillar and do a variety of student programs and other sorts of programs. I also work across at Fuqua at the Center for the Advancement of Social Entrepreneurship. And there I serve as the Center Director for SEED, the Social Entrepreneurship Accelerator at Duke, which is our development lab for scaling innovations in global health. And we're funded by USAID. And I've been at Duke a little over 10 years now. And this workshop is kind of the first time where we're trying to bring together a little bit more both general social entrepreneurship and then some global health. So we're doing 3 Fridays in a row here, 3 o'clock every Friday here in 103. And the way it works is there's like about a 90-minute session, which is kind of general social entrepreneurship, and there'll be some health examples scattered throughout. But then we've got 30 minutes at the end for those who are able to stick around and who have an interest to focus more specifically on applications to global health. And so Erica Levine is here from the Global Health Institute and will take us through a case study looking at how we apply some of this to global health. Let me first ask you, how many of you guys have been to one of the Social Entrepreneurship 101 sessions that I do, kind of the Saturday things? Okay, so about half of you, that's cool. The first few minutes will look a little bit familiar to you because I want to just lay a common groundwork. So what we decided to do is do this first session on problems, understanding problems, defining problems, and so forth. And so we kind of got a little cheeky and called this, What's Your Problem? But I think actually it's kind of interesting because we had the good fortune a few years ago of hosting a global conference on social entrepreneurship and education. And we did a TEDx, probably many of you are familiar with TED or TED conferences of speakers. And on the first night, the TED speaker said, one of the TED speakers said, you know, he dreams of a day in which students ask themselves, not what's your major, but what problem are you trying to solve? And so I was pretty inspired by that. As a matter of fact, there was an alum who was pretty inspired by that too in the audience, who took that message back to his work at the U.S. Agency for International Development, and he eventually created the Higher Education Solutions Network, which is a part of USAID funding Duke and 6 other universities to do these development labs. That's what's actually funding SEED. And so, you know, I think it's pretty compelling. What problem are you trying to solve? I would love for you to just take a minute or so and turn to someone next to you and answer that. Like, what's your problem? Is there something you're passionate about? Is it an area of interest, whether it's health or poverty or education or economic development? Is there an area that is a passion to you, or maybe one that you want to think about a little bit today? And what's that problem area look like? So turn to someone, introduce yourself, who you are, where you're from, that sort of thing. Let's take about 3 minutes to do that, and then we'll reconvene. Feel free to get up and move around if you need to. Alrighty. So I'd be curious, how many of you here are interested in issues of education? Raise your hands. How many of you are interested in issues of health? Raise your hands. How many are interested in education and poverty? About the environment? Energy? Human rights? Women and girls issues? Gosh, I could go on art, right? So I could go on to other areas. I think probably many of us have, you know, kind of interested in multiple areas. What we're going to try and use this afternoon to do is just to give you some things to think about in terms of if you're going to be approaching a problem, just a couple tools to think about using to start to address those problems and to understand those problems. I'll give you a couple kind of qualitative methods and to think about that could be helpful in kind of just sorting out causes and effects and maybe engaging with folks who are affected by those problems a little bit more. I love this quote by Einstein that says, we can't solve problems with the same thinking today that we used when we created them. One of the things that really excites me about these whole fields of social innovation and social entrepreneurship is they're really about trying to find novel approaches, novel solutions. It could be new methods, it could be new forms of distribution, it could be new higher quality, it could be issues of financing, it could be issues of networking and so forth, but kind of novel approaches to addressing critical social needs that there's a more just, efficient, effective, sustainable sort of outcome. And I've been working in the kind of field of social entrepreneurship here at Duke for a little over 10 years now, and I've really become fascinated with some of the different innovations that are out there. And so we're really going to try and talk about problems in the sense that you can then start to think about solutions. So although today is focused primarily on problems, I want to try and have you think about ways to kind of get a 30,000-foot view of a problem, and also some ways to get input from folks who are affected by problems to help you start to address them. Now, the reality is there's a lot of different ways to innovate. Whether you're creating new goods, new markets, kind of transformative change, sometimes there's something that's working in a particular industry and you want to apply to a different industry or a different area to another area. And so we're not necessarily only talking about brand new to the world here. We're not talking about something that's kind of earth-shattering, transformative innovations, but it can be simple ways of improving our outcomes and so forth as well. Greg Dees, who unfortunately passed away a little over a year ago, was the founder of CAPE. He's kind of widely seen as the academic father of the field of social entrepreneurship. He used to like to say that social entrepreneurship is the process of pursuing innovative, sustainable solutions to critical social problems, or recognizing and resourcefully pursuing these. The interesting thing about when we think about social entrepreneurs is an attempt to create systemic change and wide-scale improvements. A lot of us are familiar with some social entrepreneurs today. Muhammad Yunus, probably many of us know his role in Grameen Bank. I'll talk more about Yunus in a little case study I'll use next week. But you can think of social entrepreneurs just to commercial entrepreneurs in terms of having a lot of the same skills and so forth. But here we're talking about an intent to innovate for impact and social impact, right? The intent is to achieve a social impact of some kind, or environmental impact. For those of you who've come to my 101 sessions, you'll know that we tend to think about social entrepreneurship as a process of kind of generating promising ideas and then moving into kind of developing those ideas into attractive opportunities for social ventures or for innovations. And what I'm trying to do with this workshop today and the next couple workshops, if you kind of stick with us through the three, is really start to probe this, starting off with problem identification, then probe the area of we're going to talk about, which is once you have a problem, what's your theory of change of how you're going to how your innovation is going to make a difference? How do you know you will achieve some outcomes that will together cause your intended impact? And so today is kind of the other side of the coin of next Friday, where we start to probe theory of change, help you think about how to craft that, how to test it, how to use that to start to measure your outcomes. And then the following week, we'll get into business models. So thinking about how social ventures basically acquire, distribute, and capture value, but in this case, social value. So how does an organization bring in the resources it needs to do and deploys those for impact? And that's really what a business model is. So that'll be the following week's workshop. So they all are very related because they have to kind of support each other, and they all need to be aligned with the ecosystem in which they're working, the stakeholder environment, the other players, the political and cultural institutions of wherever you're having to work. So these are all kind of a series of issues that we'll be talking about the next few weeks here, essentially. So let's start to get into thinking about innovation and promising innovations. The reality is that if you take a look at social entrepreneurs around the world, these ideas, these innovations are coming from a variety of sources. The most obvious one is are the kind of observed needs, and that's what we're going to try and focus on more today. Or if there's a change that's coming about in the economy, or war, these kinds of things that are kind of pretty dramatic, systemic, or social sorts of changes, there are oftentimes opportunities that present themselves for innovation. But also something we won't talk about as much today, but could spend a couple hours talking about, the idea of social assets, knowing what are the assets of a community, the knowledge, the networks, the expertise, the culture and traditions and so forth. A lot of times understanding the assets of a community can really help you to build a solution, but also personal experience as well. The experience that you bring to the table, or you and your collaborators, hopefully if you're co-creating something with the community, is really important. Maybe hobbies, experiences you've had, something you've kind of stumbled across by accident and so forth. Some social entrepreneurs talk about a moment of obligation. Has anyone ever had a chance to hear Maya Ajmera speak? Maya's a Duke alumna who was our social entrepreneur in residence last year. So when she was here as a grad student, she created a venture that really kind of traced its way back to a trip she took before grad school. She was intending to come to medical school here, and instead, while she's originally, her family's from India, but she was born and grew up in eastern North Carolina. And when she was traveling through India, she came across one of these training platform schools. Essentially, she found a teacher and 20 children, sitting in a circle on the platform of a train station. And she started to talk to this teacher about, well, this is what's going on here. And she explained, all these children don't have homes, and they also don't have a place to come to school. So they come here to the train platform every day for 4 days a week, and we provide class for them. And as Maya started talking to the teacher, she said, well, this is fascinating. I mean, how do you do this? And basically, it turns out that they explained to her that it takes about $400 a year to provide this train platform school to these 20 children, essentially. And it was her moment of obligation because she was about to come back to Duke and start medical school. And she said, wait a minute, for only $400, we can help to educate, these children. We could do that many more times across India. So she actually did not go to medical school. She came here and started to delve into that a little bit more. And as she started to realize that there were many of these sorts of grassroots innovations evolving around the world that really needed support and relatively modest amounts of support. So what she did is she created the Global Fund for Children. And the Global Fund for Children, along with a series of children's books that they publish and use the income to help fund that, has funded dozens and dozens of children's NGOs around the world. And that moment of obligation was the time she recognized she couldn't not do something about this. She had to actually take some action. So that's also common when you talk to social entrepreneurs, some sort of moment of obligation. So what I want to do today is start to delve into a couple of techniques to think about, qualitative techniques for thinking about problem analysis and so forth. And the first one, we could talk about many more, and I'll kind of touch on a couple more lightly. But the first thing I want to think about is, for those of you who, how many of you had a problem area that you identified with strongly? When you turn and introduce yourself to someone next to you, there was a particular problem area that you're very, very passionate about. Raise your hand. What area interests you?
Maternal and child health.
Maternal and child health. Okay, and domestically, overseas?
I guess probably more overseas.
Overseas? Okay. Cool. Somebody else. What's an area? Yeah.
Access to education.
Access to education. Where?
For the poorest of the poor.
Okay.
So there's not necessarily a good school system.
Okay. Again, overseas, domestically? Internationally, yeah. Let's go into 2 more examples out there so we can play with these a little bit. Anybody else want to share an area that you're really passionate about? Yeah.
I'm really interested in agriculture.
Agriculture?
Use technology to solve.
Okay. So technology solutions to be able to allow, increased yield of crops and better production and quality and so on. Okay, very cool. And one more, yeah.
I want to solve the problem of procrastination in working and studying.
Ah,
Lack of drive.
very interesting. Okay, that's great. That touches many of us, perhaps, right? Like, how does one get past the kind of the inertia, right, or procrastination, and actually take some action? That's very much a problem that affects many folks. So very cool. So if you think about it, many of these things, especially some of the things around education, the agricultural issues, certainly maternal, health and so forth. These are pretty complex, wicked problems, right? They have maybe multiple causes and effects, and it's not so easy to sort out just one solution. So one technique I want to talk about a little bit that some of you may be familiar with today is kind of stepping back and starting to think about the various causes and the contributing factors that actually contribute to a problem, and then thinking about some of the effects of that problem. So we can start to have a very visual kind of map, essentially, of the problem. That will then help us later as we start to identify what the innovation is to actually address that problem, right? We're going to talk a little bit about problem trees. So essentially, a problem tree is kind of a very visual representation of whatever problem you're trying to work on, and it starts to differentiate into what are the root causes and what are some of the effects and so forth, so that you can then refine your problem. Because one of the challenges here in doing this work is your problem definition, how it is you're actually defining the problem. Remember when I asked you, is it domestic, is it international? Is it, the more you have definition around that to particular communities and cultures and age groups or geographies and so forth, the more you can start to look at an appropriate solution. So the nice thing about problem trees is they start to allow you to pick apart a problem and see where in the system of causes and effects do you think you may be able to bring something to the table for an innovation. So let me show you a real simple example here. This may be hard to read. I know the next one will be definitely hard to read. But the idea here might be about low farm productivity, all right? And let's just imagine this is a very simplified version. But let's just imagine we were to look into this a little bit more and go out into the field and gather some data and talk to some people and so forth. What we might find is there's a variety of different causes. One of them might be that there's low labor productivity because the folks in the field or working on the farm may not have the most modern techniques or technologies and so forth. Maybe there's post-harvest losses that the crops are harvested, not stored in adequate storage, and therefore they're wasting. Low soil fertility, maybe inefficient extension services. They're not folks out in the field prepared to train the agricultural workers to kind of improve their skills. And we could probably go on and on and on. So the idea, if you think of it as a tree, is here's the trunk, the main area we're looking at about productivity, and here are some of the factors. Now, in the same way, we could think about effects. Talking about low farm productivity, what might be some of the effects? Well, maybe there's low nutritional intake, right? Because you don't have enough of the agricultural products, therefore there's not a varied diet. And therefore that then in turn results in poor health conditions of the rural population. Or maybe because of the low productivity, you don't have a lot of surplus, so small family farmers aren't able to sell much, and so therefore there's not much of a marketable surplus, and therefore they don't have a lot of income from that. Right? So you can see the basic idea, right? Causes, effects, the tree in the middle. This one's way hard to see, so it's okay. But the basic idea is it's talking about malnutrition of children under 5s. What some of the causes might be? Well, maybe it's inadequate food intake, poor child care, poor weaning foods, food shortages, and so forth. And they have all kinds of issues around health issues and performance in school and stunting of growth and these kinds of things, essentially. Who knows what this is? Anybody know what that is? What do you think you know it is? If you don't think you know it is? Virus, is that here? Which virus? What's that? Ebola, right? How many of you had a chance in the fall to participate in the Duke Ebola Innovation Challenge? Here? Okay, cool. That's great. There are a few here. I'm glad you're here. What about, let's just kind of take a group example. Turn to someone near you, and even if you don't know anything about Ebola than what you've heard on the news and so forth, what do you think might, and let's frame the problem a little bit more, and let's say it's the rapid spread of the Ebola virus in West Africa during the last season, essentially, right? So turn to someone next to you and think about this side. What do you think are some of the causes or contributing factors? What caused or contributed to the fact that the virus was spreading quickly? And this side, turn to someone next to you and think about what are some of the effects? Because that was spreading, how did that have an effect on the population, okay? So let's take about maybe 3-4 minutes, just real briefly. Turn to someone next to you. What are some of the causes? What are some of the effects? Feel free to move around if you need to get to near somebody. So let's see. This side I had to do causes, right? This side I had to do effects. So let's put our tree on the side since we're not having we've got kind of a long board here. I'd love to get a couple examples of what some of the causes might have been. Now again, we'd need to go and study and gather more data and understand more rigorously. Just from common knowledge, what do you think might have been some of the causes? Just raise your hands, a few out on the table. Yeah?
Close contact and physical contact.
Okay. And there'll be a number of examples of that, right? It could be both with folks who were living and infected, but also with the deceased and contact with folks. So we could take that and go a little bit deeper and say what are the different types of contact that may have happened. Okay, so that's a good one. What's another thing? Yeah.
Lack of proper infrastructure.
Okay, and tell me a little bit more about that. What sorts of infrastructure are you talking about?
They quarantines in the United States, they don't particularly have infrastructure to have the extent.
Okay. Medical facilities, all kinds of stuff, right? We could then start to explore that one much more deeply as well. Yep.
Kind of like lack of education on how to protect yourself.
Okay, so lack of kind of awareness and education on proper steps to take to protect yourself. And probably on other things too, like on what to do if you have it. So a lot of different forms of education and awareness. Yep. Mm-hmm.
The drug company didn't have strong motivation to invest on the drug.
Yeah, I'm sorry. Who?
The
drug company.
Drug companies, yep. So pharmaceuticals didn't have a lot of incentives to be putting, medications out. So pharma kind of, I'm going to say, didn't have incentives, right? And so that then causes the fact that there's not a proper, medicines and so forth, and right? So we can start to explore that a little bit more. What else? Yeah.
Difficulty to tell Ebola from other flu in early symptoms.
Okay, yep. So difficulty with kind of diagnosing, right? Great. And we could go a lot farther than that, but that's just a few of the ideas on the map, or on kind of some of the roots of the tree. Now, each of these, we could start to go deeper and deeper. Okay, so what are some of the causes of the difficulty of diagnosing? What are some of the causes of the lack of infrastructure? So you can imagine this then starts to build out kind of almost like a root system if you're thinking of a tree, right? And some of these things have, causal factors across them. But so what we're starting to build out is a better understanding of causes. But for the purpose of discussion here, let's just kind of leave that there for now. How about on this side? You're kind of brainstorming some of the effects. So what were some of the effects? Raise your hand and kind of share a few. Yeah.
Low economic productivity.
Okay, so low economic productivity. And again, we could start to trace that up the tree a little bit and say, okay, well then, what's an effect of that? So, what do you think would have been a kind of further effect of that? An order effect.
For example, farmers might be working. There's food shortages.
Okay, yeah. So we can start to trace those out, right? What else? What were some other effects, do you think? Yeah, please.
Talking about like national protocols, so like screenings at airports, quarantine regulations.
Screenings, all the things that were kind of either put in place or maybe weren't put in place, and eventually were put in place or were put in place poorly, and so forth, right? What other effects? Yeah.
The unrest.
Yep. What else? Yeah.
We were also talking about how countries that were most affected built the infrastructure to take care of all of this thing.
Yeah. Yep. And so having to cobble together the infrastructure after it occurred. Gotcha. Okay. Yep. So cobbled or improvised infrastructure, perhaps, right?
Yeah, and how to use money and those sort of things.
Okay. Any other? There's plenty more we could talk about. Let's get a few more up there. Yeah.
Just the opportunity cost that countries and NGOs that focus on funding this, when those resources could have been used for something else.
Yeah.
Well,
Well, and some of these economies, they had really been rallying in the previous several years and so forth. Just think of the huge opportunity costs there and the effects there, right? So we could obviously explore this much more deeply. But the idea being here, we're starting to build out, a tree essentially of causes and effects, And some of these things are just reinforcing, right? And so the idea behind the problem tree is just a simple tool to help us start to graphically get a sense of causes and effects, so that as we start to get to the next stage of kind of developing the innovation, we can start to both either refine the problem statement. So one of the things I often find with students in particular who are working on kind of innovations is that the innovation itself, I sometimes say it's a solution seeking a problem. It's some cool, neat widget essentially, but it's not really clear what problem it's solving. Or it may be they may be thinking they're addressing a problem, but they're not addressing the underlying causes. So a common example of the latter would be filters, for example. If a student comes and has been working in a village in such and such a place, and they've got a biosand filter, for example. If we were to really understand things a little bit more deeply, the solution isn't simply that widget. So much of the solution is going to depend on our understanding of causes and effects if we want that solution to be effective, because just the filter itself is just a piece of the problem, right? What are some of the other contributing factors to that problem that are going to be affecting access and use of clean water, do you think? Not just a filter, but there's a lot of things around that, you think. What might some of the other contributing factors be? Yeah. Right, okay, so there may be toxins that can't actually be filtered out successfully by this filter. So that's a really good point. Are there other issues, do you think? Yeah.
Like education, how to use it properly.
Yeah, so both using the filter and maybe maintaining the filter properly. What else? Yeah.
Availability and accessibility.
Okay, absolutely. Other issues? How do people feel about water in this filter? clean water mean? Is it important? Are the vessels that are being, the bowls or pots that are being filled, are they clean? Are hands clean? Even if you successfully filter it, if there's bacteria elsewhere, is that really going to? How do people think about rights, access to water, and governance of water? And so there's a much more complex set of issues here that need to be dealt with beyond just the widget or the filter. And so the reason why I encourage kind of the problem tree is just a simple exercise, is to start to get a better sense of all these contributing factors, causes, and effects. So then you can either refine your problem statement, have a very clear kind of focus, because maybe what you really need to be addressing is this, right? If you want to have any hope focusing on this problem, you need to be focusing on this root cause or that root cause. Or maybe you're finding that what you really need to do if you really hope to have some impact is kind of ameliorating some of these effects, right? And maybe it's a matter of you've got the wrong problem, right? So it can be a very simple but very powerful tool to help us refine our problem statement. So for those of you who had a passion, one over here was education, right? Where was education? Okay, so are there a couple particular causes of some of the challenges you're focused on in education that you're more passionate about? I mean, what are some of the causes of the issue that you think is kind of important to address?
I guess the financial models don't work.
Okay.
It's not affordable
Yeah.
for folks, or the public funding just isn't enough to cover everybody.
Okay, so if we were to look at that as kind of access to education, well, then we can start to break that down. One of the key causes of lack of access may be, it's just not fun, it's not affordable, right? It might not be there might not be financing mechanisms. It might be because the schooling can't be provided. It might be because the individual child can't afford to go. It might be because they can't have teachers that are properly skilled. So access has a lot of different issues, right? How about one was interested in agriculture, right? What's a cause that you think would be important to address in agriculture?
A population, like a growing population.
Okay.
Demanding more food.
Okay, so growing population. And so you mentioned you were interested in technologies that maybe, in this case, maybe you're having a technology that will allow, higher yields or something to kind of address some of the need for the growing population, right? The maternal health over here, is there something in particular that interests you about maternal health that's one of the causal factors that you'd want to consider addressing?
I guess access to healthcare in general.
Yeah.
Pretty general.
Right.
When a mother's in labor, it's important just to be able to have access to a healthcare worker to ensure that everything goes okay.
That's right. That's right.
And that's a fundamental issue that isn't just about maternal and child health.
Yep, and it's the mother and it's the child. I don't know, for the of you who were with me, on Saturday in the Social Entrepreneurship 101, I showed a little 2-minute maternal and child health video from the Saving Lives at Birth by USAID that is kind of a really nicely done kind of explanation of some of the real issues. So you get the basic idea here. We're trying to understand a little bit more causes and effects and so forth. So another approach I want you to think about. So first of all, if you're in a competition, or if you're actually working on something in a class or a venture, really start to dig into causes, effects, understand where you're targeting your solution. I also want to talk a little bit about thinking about some approaches that are emerging from human-centered design. So, as some of you may know, our field of social entrepreneurship intersects with a lot of other fields. And one area that's been really exciting to watch over the last 10 years, last 5 or so years in particular, is professionals who are working in fields of design, so graphic and industrial design and so forth, drawing upon the skills of a designer to better address social or environmental challenges. If a designer is going in and maybe looking at trying to understand the products they're trying to produce, experience they're trying to produce, trying to better understand the needs of the consumer or user and use that to kind of support their development of the design, essentially. So, how do we really understand user needs, insights to solve those needs, and how do we, really have contact, observation, and most importantly, empathy for users? In this case, it's beneficiaries, primary constituents, use whatever term you want to use, and so that you can actually kind of design or hopefully co-create solutions. And so in the human-centered design, your solutions are focusing on desirability. What do people actually desire? Feasibility. Can you actually technically implement this thing? So let's go back to the filter. What if this filter required materials for maintenance that aren't even available in that community. Well, it's not a very feasible solution, right, if people don't have access to those. And viability was, will this thing kind of survive? Is it sustainable? Is there a financial model that would allow it to persist, you know? And so the reality about the design process is it may seem like a linear process where you're observing and understanding, synthesizing. You know, one of the kind of things that I think that designers bring to this field is the idea of prototyping. Prototype something, test it, refine it. Prototype, test it, refine it. Before you're spending a lot of money on a big, you know, solution, you're trying to get feedback. But the reality is it's not quite so linear. In fact, it's more of an iterative process where you're, you know, maybe doing some field observation and you're rapid prototyping, and then maybe you're building out something a little bit more concretely and so forth. So it's not quite as simple as a straightforward process. But what I do like is IDEO is one of the big design firms that's very interested in this area, has kind of a nice way of thinking about it, is moving through 3 phases. One, hearing, so where you're gathering stories, you're observing, you're listening essentially, trying to understand the environment and need. Then you're creating, you're going through a process of you know, creating solutions, and then you're prototyping them and testing them, and then delivering, where you're actually kind of delivering the actual innovation. So let's do a couple little exercises here. One is I'm going to actually show you a picture, and I want you to think for a second, just yourself, and I'll have you share it with somebody next to you. What's standing out to you? What do you actually see? Okay, so let me turn the slide. Now think about this for a second. I want you to think, what do you see? What's happening in this slide? Okay, take about a few seconds or so to start. Okay, now turn to someone around you and describe what do you see. Describe what you see, and then hear what does the other person see? What's happening here? What do you see? What do you see there? Well, let's go.
Yeah, I just want to, I think, actually we think that that the people might be just carrying water into the hospital. We're not sure if that's
Okay,
possible or not.
but that's what you see at least. Okay, somebody else. What did you see, or what did you observe? What do you think is going on here?
People taking some kind of liquid containers to a special place to get them filled, because the 2 people have like matching kind of uniform lab coat thing, so they have access to something that the other people need.
Okay, so you see there's some lab coats going on, some boots here,
Yeah.
and like the other group, you saw these containers, and these people are bringing them in. In this case, what else? What do you see happening? Yeah.
Those look like they might be safety boots or something, so
Okay.
maybe working with some medical, chemical, something like that.
Okay. The medical or chemical sort of fluid? Well, I want you to think about this. When you looked at that, what was the personal experience that you were drawing upon? What from your own life experience was filtering your observation, right? Next thing is, like, could you actually maybe start to train yourself to look at it from the mind of a beginner, someone who maybe doesn't put as many assumptions in and is trying to look at it for the first time and observing that way? More importantly, if you were to be able to, what questions do you think you'd ask? If you were in this situation, you were actually observing this and weren't making assumptions, what kinds of questions would you ask to better understand the activity in the scene? So what would be some questions you might ask? Yeah, I think it's, what?
What's in the containers?
What's in the containers, right? What else could you ask? Yeah.
Who are those people in white coats?
Okay, who are the people in the white coats? What are they doing? What else? Yeah.
Where are they taking those containers?
Where are they taking? Are they being delivered? Are they being taken out? You know, that's a good question. You don't really know about that, do we? Any other questions one might want to ask? Yeah.
What is the purpose of that building?
What is the purpose of the building? Someone said it was a special place or a center or something like that. You really couldn't see because of the lights. There was some equipment in the inside. There was like some tables and so forth. So, you know, it's the old. You ever see the old picture of the? It's either a vase or it's 2 people looking at each other. Or there's the one picture of the older lady with the feathers, but then if you look at it, it's a young lady. You know, it really depends a lot on our perspective. And so the idea we want to take here in human-centered design is really approaching it from a position of empathy and trying to deeply understand and bringing the beginner's mind, right? I love this quote, the beginner's mind, there are as many possibilities, and the expert's mind, there are few. You know, being able to approach something from a new perspective to then open up opportunities to better understand and perhaps create some solutions. So let's try this again, okay? I'm going to show you another picture, and this time we'll all have beginner's mind, right? And we're actually going to have a few questions. I want you to think about, describe what you see, but don't interpret. Be able to describe what you can see. And I want you to think about 5 different possible interpretations. I'll let you do this in pairs. Turn to someone around you. What could be 5 interpretations for that behavior, right? And then what's a couple questions you could ask to determine whether or not your interpretation is right? So let's do this 3 and 3. Figure out like 3 interpretations, how about? And then a couple questions you might ask to determine that. All right, so let's look at this picture here. Now, turn to someone next to you. We're going to give you guys about 4 minutes to do this, right?
Maybe they don't want to do it. Yeah. How would you find out? By asking her? I mean, yeah.
Rather than going to what you see happening, what do you think might be what might be some interpretations here? What might be your interpretation of what's actually happening? Yeah.
She's trying to get rid of an animal.
Oh, she's trying to get rid of an animal. Isn't it interesting how the stick kind of disappears at the top of the picture? So you don't really know what's going on. She's trying to get rid of an animal. Very creative. What's that? You have one? Did you have one?
Yeah, I have one from experience. I think
Oh, please.
drying her clothes.
Ah, she's drying her clothes.
Finding a place to hang her clothes.
Ah, so she's putting a hanger on the end of it, and she's hooking it up to the clothesline or something up there, perhaps. Okay, are there interpretations? And you just said from your own experience, so you're drawing on that, yeah. Uh-huh.
She's trying to take the clothes down because there's plastic or something in the bottom. So
Oh, no, look at that. So she's actually going to bring the clothes down and then kind of wrap it or something, or putting it in a bag, or...
Because it might rain because I feel like that's
Okay.
something covered.
Very observant, right? What else? Anybody have any other interpretations? Okay, but what are some questions one could ask besides just what are you doing? Are there other questions you could ask? Oh, I ruled that one out. So what's some questions one might ask about this? Yeah.
Like, where are you? Is this your home?
Okay. Is this your home? You think this is home? You think it's... so what else? What other questions?
What about the bottom is painted white?
Ah, isn't that interesting? Yep. So you may want to ask why it's just that. So this idea here is, we so often look and interpret and add our filters. What the human-centered design approach kind of works on is helping you to take a more kind of dispassionate, unfiltered observer role to really understand what's going on and some of the implications and meanings to then start to be better able to co-create a solution. So the idea being that what you do is you start with a design challenge. And a particular challenge is usually defined in very human terms rather than starting with, oh, we need a technology for this. No, the question is, what is the experience you need, or what is the outcome you're looking for? And then we start to worry about the technology or the means, or the hows, essentially. But starting with very human terms and being broad enough to discover areas that may not have first occurred to you, but near enough to make this manageable. And so typically, starting from a point of empathy, we create a challenge statement. How might we? How can we? So you're framing the question in a way that allows some brainstorming, that allows some development in a way that can lead to some creative answers. So let me show you an example. And first of all, usually the challenge statement has a sense of who is affected or who is the person that's kind of the actor in the statement. Where is it going on in the behavior, the related behavior? Now, it may be a behavior change, or it might be some effect, essentially. So let's give you an example. Here's one that a team, this comes from a team from Design for America at Northwestern, and their challenge to me was, how can we make it easier for doctors and nurses to sanitize their hands in a patient's room? So they had gone in, before coming to this design statement, challenge statement, they had gone in and knew that one of the challenges was how to prevent, infections and acquired and also spread of viruses and stuff like that in the hospitals. And they went in and did a bunch of observation. And one of the things they came away with is, there's a lack of proper hand hygiene in hospitals. So they created this challenge statement of how can we make it easier for doctors and nurses to sanitize their hands in a patient's room. So there's who's involved, it's a location, and it's a behavior, right? Now, what they started to do is, as they went in and observed, asked questions, and so forth, they started to gain kind of tidbits of information, little bits of insights that help them understand things to be directly applicable for the innovation itself. So, for example, they found out that when trying to reduce the amount of hospital-acquired infections, doctors and nurses touch a lot of things in the patient's room, right? So they're putting their hands on a lot of different things. when hand sanitization actually happens, it may be because there's some sanitizer when you first come into the room, and that may be used, but then once they're in the room, you're touching again. And then washing hands at the in-room sink tends to take too long, so as they observed, very few of the doctors and nurses actually took the time to go and wash their hands that way. So the insight was that they don't really have access to quick hand sanitization sources in a patient's room, is the real kind of insight. And so what they came up with is this. Let me show you a little video here. If you actually watch their pitch, they did a pitch at a competition for some money. I was struck by it because within like the first 2 minutes, not even the first 2 minutes, within the first minute, they're actually citing a study out of Duke. It's like, wow, they're actually talking about a Duke study. How come we didn't come up with this idea, right? So, but you get the idea, right? So what they've done is they've identified a concrete design challenge and gone in and then, through observation, through interviewing, through a lot of qualitative work, they've tried to understand kind of how that challenge actually plays out, so they can then try and identify. In a sense, it's almost like thinking about causes and effects, right, and finding out where in the system can you intervene. So this hand hygiene swipe sense just clips right on, and you just kind of press the button and off it goes. And what's cool is it's kind of connected wirelessly, so you can actually be monitoring use of it and so forth. So the idea is, if you think back to that kind of cycle I showed, the IDEO cycle, you're hearing, you're creating, you're implementing. Essentially here we're trying to collect stories, observations of reality, understanding of needs, barriers, and constraints, right? So the use we often use here is a variety of different qualitative methods, essentially, right? Anybody familiar with some qualitative, what I'm talking about when I say qualitative methods? What are some particular methods that you can use for observation and gathering of data to better understand a problem? You may have a sense of what I'm talking about? What are some examples of that? Yeah.
Like interviews.
Okay, interviewing, right?
Instead of statistics, or telling your anecdote stories.
Yeah. Things that are going to kind of complement the more rigorous, analysis you may have done drawing upon more rigorous data sets. You're maybe gathering stories. What else? What other sorts of qualitative methods can we use? Yeah.
Also focus groups.
Focus groups. So what's a focus group for folks who aren't familiar?
So like a group of like 8 to 10 people that kind of lead a discussion with different questions. And
Okay.
see if there's common themes or keywords that can.
Yep. So you kind of walk them through a protocol, these questions, understand kind of their experiences with whatever the situation or product or challenge or issue is, right? Other techniques one can use? Yeah.
Visual observation.
Visual observation, yep. Going in, maybe you're actually looking for certain behaviors and you're taking note, ticks and so forth, tallies, yeah. Surveys, right? You can do a mini survey, quick, sheet out survey. Actually, one of the things that our global health social entrepreneurs, especially in East Africa and India for the SEED program, one of the techniques that one has been using and shared with the others is a simple survey while patients are sitting in a clinic. If they're trying to get feedback on either a price point or a new service or whatever, they've been using this where they take like 2 to 4 slips of paper, and each slip has a different solution or issue or price point or whatever it is. And it's a form of a survey, essentially, where they're going down and they're saying, which one of these would you be most likely to purchase, or which one would most likely benefit your family, or whatever the question happens to be. And just by drawing the paper, they start to take drawing out the paper, they start to take a tally. So it's an interesting way of conducting a survey, right? So these kinds of methods that we're talking about here, kind of, reviews and interview, you might do community interviewing, participatory sorts of things. I like instrumented group interviews, which are like a focus group that have a mini survey up front, because then the folks who are doing it can tally up the survey and use that to help affect some of the questions and so forth. These are all relatively informal methods. They are of low cost. They are not high quality in terms of they don't lead you with a lot of, a lot of quantitative understanding. You really got to supplement with your data, but they can be really powerful to understand what we're talking about here, which is stories, insights, qualitative understandings that will help you address the problem. So I want to give you another example. This is actually a live example right now. Chase is here, who is a student who's actually in Design for America, the Duke chapter, and Chase is actually working on innovation right now. So you want to come up and talk a little bit what you're doing and kind of introduce this? Yeah.
My name is Chase. I'm a sophomore here. I'm involved with Design for America, and we've actually been following a lot of the human-centered design process. So a team of 6 of us, we started off last year, and we focused on nursing homes. So we said, we're going to go into nursing homes and we're going to try to solve a problem, and then we're going to find a solution for it. So we went into nursing homes around Durham, and we spent a lot of time with the residents. We talked to them, we talked to the nurses, we talked to their families, and really tried to figure out what their problems were. Eventually, we realized that one of the major problems was loneliness. Residents spend hours upon hours in these homes by themselves with no one to talk to. And I know I can speak for myself with my grandma, because she lived with them for 5 years, and she was always lonely, and she loved to talk to people. So we kept researching, and we eventually realized that the best way to mitigate this was for them to have contact with family and friends. But the problem was that these residents aren't updated with the new technology, so they aren't really good to use phones. They have a lot of mental diseases, so they forget things often. So we researched, and we brought in a stuffed animal that spoke and vibrated a little bit, and we gave them to a number of residents, let them keep them, and see what they thought about it. And they loved it. They absolutely loved having something in their hands, just playing with it. It kept them very, very satisfied during the day. So we came up with the idea called Teddy, and the concept is it's a stuffed teddy bear that's connected to an app. So from anywhere in the world through Wi-Fi, you can record a message, and then on the bear, the stuffed bear, you can push a button, and the bear will play that message. So for example, say you're a 75-year-old grandma in a nursing home and you never get to see your grandchildren. Well, your grandchildren who are up to date with technology can pull up an app every day and say, "Hi grandma, how are you doing? I went to my class today, did this and this." And then the grandmother in the nursing home can push the button and listen to that message as many times as she wants. So we run this by a number of nurses and people in nursing homes. They love the idea. And then we continued to develop it, and we thought, well, maybe there's other applications for this. So we thought about military uses. So perhaps you give it to a military family, and the dad overseas has a phone, and he can say good morning to his daughter every morning through the app and the stuffed bear. So recently I met with Matt and Kathleen the other day, and we've started a prototype. We'll be building 10 prototypes in the upcoming weeks with the Innovation Co-Lab at Duke. We've recently received a grant there. But the whole concept is that we found the problem first, and then we found the solution for it, and that's proved to be very successful for us so far.
Can you tell us a little bit more what you're hoping to learn in the prototyping phase?
Yeah. So the goal is that we're going to make the 10 prototypes, and then we're going to give them out to residents that are involved in the Ronald McDonald House. So we really want to figure out what is wrong with it. So we're going to do a little bit of concept-based testing where we will give it out to them for a week, bring them back in, interview them, ask them what was good about it, what was bad about it, would you buy this, how much would you pay for it, and then ask them things like, what can you do to make it better? And then we'll continue that process until we feel like we have a prototype that we're ready to take to the market. So.
Very cool. And what are some of the challenges you think you're going to face kind of going to the next level and stuff?
We've had a ton of challenges actually. Most recently, a lot of it's been competition. So we see that there's a lot of things out there that are like ours. But the thing is that we have found a place that we are different in a way that we can maximize our hardware and concept. Another challenge is just getting people to buy into your idea. A lot of times people will just put you off and be like, oh, it's just like another idea, you're not going to do anything with it. You have to be able to convince people that you're actually going to follow through with it. And I think that, Design for America has done a great job of that. They have a lot of opportunities to do that. And it's all through the concept that you've been talking about today. So.
Yeah, tell us just, if you don't mind, a little bit, just real briefly, the folks, anybody else here in Design for America? A few folks, cool. What do you guys do, and how do you, just as a program, it's open to undergrads and grad students, I know, but just for folks who might be interested, what's it all about?
Definitely. So at the beginning of every semester, you start off with a team of 6 people, 5 or 6 people, and you pick a problem space. So it might be worker safety, it might be child care, it might be the elderly. And then you form this how can we statement. So it might be how can we help underprivileged children get a better understanding of technology. And so from there you continue these how can we statements and you just keep moving along. We are huge on partnerships, so we partner with a lot of local organizations in trying to get a better understanding of the concept. And then we just keep working through, and eventually in the last month of the semester you prototype. And the goal is to bring it to the people that you were trying to help. But yeah.
That's great. If anyone wants to get involved, you guys recruit in the fall, right? Or,
Yes, actually we just finished recruitment, but we'll have recruitment open in the next year. We love new members. We're a growing chapter. It's our, I think, 3rd year here. I think there's about 40 members, so it's a good platform.
That's awesome. We showed, I don't know if you were around quite yet, but we showed the Swipe Sense, a short video.
Yeah.
Those founders were actually some of the founders of Design for America. So maybe just take a couple quick questions for Chase. I mean, obviously we're starting to talk about prototyping and all that stuff, but going back to the problem definition and analysis, any just general questions of that nature? We won't worry about the feasibility and all that kind of stuff. That's for another time. Any questions about? I'd be curious, like, tell me a little bit more about the experience of going and observing in the nursing homes. Like, what did you do? How did you structure that? How did you gather data?
So really, we would just go in and spend maybe 3 or 4 hours a week in there, just spending time with residents and spending time with the staff. So we'd sit down with them and we'd start talking about like their lives and what they like to do and what their problems are. But it's very, very difficult with a lot of these people in these nursing homes because a lot of them they're in there for a reason because they can't take care of themselves anymore. So they continually just repeat themselves. A lot of them had Alzheimer's, a lot of them had dementia. But you have to just find a way to get around that and take the things that you think are important to your problem and run with that. So I think that when we realized that people really couldn't remember things, we thought, oh, well, it'd be awesome if you had something that they could always have and always use, because then there's no need for the memory aspect of it. But really, it's just we spent a lot of time just trying to get to know them and really like become immersed in the culture of the nursing home that we were working with.
Great. Question? Yeah, please.
I just have a quick question. What about nursing homes? Like, what drew you to nursing homes first? What made that decision for you?
Yeah, so there were actually one member of our group. He had a grandmother who was in a nursing home. He was really not satisfied with the conditions that were there. And also, I was very interested in it as well. My grandma lived in a nursing home for 5 years. It was a very, very nice nursing home. But whenever we came, the first thing out of our mouth would be like, they're out to get me, like all these things that like clearly weren't true, but there were like, it became very evident to me that there were major issues there. So it was like I had a reason to pursue this problem.
Well, thanks for appreciate that. So what I'd like for you to do is to turn this again to someone around you, and for at least one of you, maybe both of you, if you had to, remember I asked you in the beginning if there was a passion or problem that you had or whatever, let's try and craft a design statement, or challenge statement rather, for that particular problem. So remember we talked about the behavior you're trying to change, the actor essentially, or the individual, the user, and the location, right? So what I'd love for you to do is just take out a piece of paper or just do it verbally or on the slide here. Think through what's a design statement, a challenge statement that you could craft that's relevant to that problem that you just had. Or if you can't think of a problem, use Ebola. That's fine, all right? So let's take about 3, 4, or 5 minutes to do that with someone next to you. So one of you can pick and maybe, and the other one can help, all right? So let's go ahead and try that. I'll put an example up here so you can remember what it looks like.
I think it's just, I think they're still like,
Okay. Can we get a couple examples? Do folks mind sharing an example of a challenge statement that you crafted? It usually starts with how can we, how might we, that sort of thing, and then it has whatever is the behavior you're trying to change for a particular user or actor and location. Can we get a couple examples? Maybe it's not fully fleshed out and refined. That's okay. Yeah.
So I'm actually in Design for America.
Cool.
And my team is we just started with our problem space of childhood drowning.
Great.
So we're still kind of researching.
Childhood drowning.
Yeah.
Ah.
So we're still
okay. So where are you? Tell me where you are right now with that one.
So right now we're planning to interview different actors in situations. So maybe like parents, lifeguards, maybe first responders, and just learn more about drowning in general. And we're also planning to go out to homes and go see pools, go see where the problems are, and learn about pool regulations, all that kind of stuff.
Do you know that a few years ago, Business Week did their top 20 or 25 for-profit social entrepreneurs, and one of those is a Duke alum who's right here in the Triangle, and perhaps is responsible for more than any other person in the country for dramatically reducing drownings in YMCA pools. Do you know who that might be? Who's that? Kevin Trapani, absolutely. Kevin, the head of the Redwoods Group, which is an insurance company that focuses on Ys and pools. So one thing you should definitely do is interview Kevin and some of his staff and understand some of the techniques he did. So email me afterwards, and I'll shoot a note to Kevin and Christina, his assistant, and see if you can sit down over coffee. He'd love to chat with you. He'll actually be here next week. On Wednesday, if you guys don't know, next Wednesday is the Duke Conference on Sustainable Business and Social Impact. It's the 10th annual conference of the Fuqua Net Impact Club, and so they're going to have all day Wednesday. They'll have the Secretary of Labor, the CEO of Seventh Generation, and probably about 40 or so different speakers and panelists. Incredible. Even if you could stop by for an hour, you'd really find it amazing. The Secretary of Labor is going to be talking about the future of work in America and the importance of sustainable business. Anyway, so Kevin, I think Kevin's actually leading the discussion with the Secretary, if I'm not mistaken. But anyways, he'll be here on campus. So we can connect you, but he'd be an interesting person to talk to. So where are you guys in terms of crafting your design challenge? Your statement, rather, your challenge.
We just started really like 2 weeks ago, like thinking about the topic. So we're just kind of in the research phase. Like as I said, we're like starting to reach out to people, interviews, and like we're still planning when we're gonna like go out and see different sites, I guess. But we're like really beginning right now.
Very cool. Very cool. Well, Kevin worked with YMCA's and helped put in place some protocols that have helped reduce drownings pretty dramatically. What's somebody else? Can you share a challenge statement that you crafted? Looking for textbook down here, just yeah.
We said, how can we make it easier or safer for nurses to care for patients in the workplace?
And how can we make it safer for nurses? In a little bit louder for the last part.
To care for patients in the workplace.
Okay, how can we make it safer to care for patients in the workplace? And are there particular injuries or illnesses or infections, like certain things that you have in mind in particular?
Yeah, like back and neck injuries.
Okay. Okay, very interesting. Can we get a few more examples? Yeah, please.
How can we help farmers to select their crop to be profitable?
Okay. And now, do you have a particular part of the world or a country or something you're interested in particular?
No.
Okay. So that could be a way we could narrow it down a little bit more too, is like figure out if it's rural North Carolina, or if it's West Africa and so forth. Yeah, please.
How can we motivate teachers to use more interactive curriculum in urban slums in India?
Fascinating. Are you in the Hope Prize?
Yeah, I was.
Okay, cool. Are you one of the teams that's still in it?
No, we are finalists.
Okay. That's right. I thought you looked familiar. Folks might know that President Clinton every year works the Hope Prize competition to announce an innovation challenge, and then teams can apply and work on projects. And we had 22 or 23 teams here at Duke compete, and 3 have been accepted to the next round. And then there's another round, and the ultimate prize is $1 million. So, is there maybe one more example? I'd love to know your example. You had one. Was it like motivation or something like that? Drive? Tell us what you have.
How can we make it easier for students and employees to feel motivated, satisfied, and have a sense of achievement in working and studying?
Very interesting. And now you're talking generally, or is it in this community or a certain other community, or?
Generally, because it's a worldwide.
And is it college students, high school students?
Basically, more college students and employees, because in my field, software engineers are very pushed, like they are forced to do their work, and they don't like it.
Fascinating. Okay. Well, so very cool. So you've got a challenge statement. So the idea being, once you have crafted your challenge statement, essentially, then you start to gather data to try and look for the insights and tidbits of information that might help you design a solution, essentially. So that's a really fascinating area that there's lots more to talk about there, but I just want to give you a sense of that. For the idea being gather stories, observations, to gain deeper understandings and so forth, to be able to then, and using these sorts of methods. Let me just comment on 2 other things before I make a couple other comments, and then let Erica come up and talk about applying this in global health. Another thing to think about is, can you find points of leverage, areas where you can make an effort to intervene in a system to actually have make a difference. So for example, when we think about social entrepreneurs, we often think about an ecosystem that looks like this, where there are resource providers, there'll be funders, donors, and so forth. There are the beneficiaries or customers or primary constituents or clients, whatever term, this particular field is using. There are competitors, allies, opponents, bystanders. There's certainly, the political factor and public sector issues, economics, market forces, culture, geography, infrastructure. So if you think about all the different players and forces that are having an effect, one of the things that was an interesting example of this, anybody know self-help here in Durham? Self-help? Self-help is the largest nonprofit community development finance institution in the country. It's based here in Durham, but they have branches in California and Virginia and other places. And they're a credit union. They do a lot of things. But one of the things that they did a number of years ago is they looked at some issues in the ecosystem that were kind of having negative impact on their borrowers. One of the things was, for example, predatory loans. That some folks who were of low income, who were having their savings at self-help or maybe financing their home purchases, were running into some predatory lenders who were trying to make some bad deals that they could then take their cars or take their homes away from, not usually their homes, because they were usually self-help mortgages. And so then self-help decided that an issue that they could take on is predatory lending. So they started to work on policies that would then help to kind of make it much more difficult for predatory lenders to operate in North Carolina. And then it was so successful that they got written into the federal legislation, the TARP legislation. And so they would look for ways to make policy change as a way of impact. Another thing they did is they helped to create a secondary market for a particular type of mortgage for low-income folks that helped make those securities more tradable. Another interesting thing is in the private sector, Clay Christensen is a professor up at Harvard who writes a lot about innovation. He's probably one of the top innovation gurus. He has a particular approach called the jobs method. Essentially, the idea is you look at the jobs to be done, and I'll talk more about that in a second, the objectives that need to be addressed, the barriers that are preventing achievement of those objectives, and solutions. Now, jobs to be done, what I mean about that is looking at any particular situation and understanding all the things that need to happen. And I don't mean job in the sense of a traditional 9-to-5 job. I'm thinking about functions, things that need to happen. So, for example, if we think jobs to be done in a nursing environment, for example, let's take something very specific. Maybe it's a nurse that is needs to maybe move a patient, let's say, from one bed to another. If we start to break apart that whole thing, there's a lot of little things that need to be done by various individuals. So someone first needs to kind of identify the need to move the patient. It might not be the nurse, it might have been a doctor or someone else, and maybe there's an administrator who actually has to assign a particular nurse to do that, right? The nurse and maybe an attendant or others actually have to be the ones that actually move this person. Someone else is probably, or maybe it's them, also taking notes on the move. So there's a lot of little individual steps or jobs to be done. And if you think about that, if you take a particular social situation and identify what all of these little things that need to be done, same thing over here, maybe in the pool, the drowning in pools, right? There are everything from, people have to admit the children to the pool, right? The children actually have to be able to be in the pool. There's a lifeguard watching, there's the child actually has to enter the pool, swim in the pool, there's all kinds of little things. And by doing that, you start to break down step by step, are there changes that can be made to try and have a greater impact, essentially. That's called a jobs to be done approach. And it's actually a fascinating model, but it turns out a lot of corporations that are trying to support more innovation within their corporations are taking this model and using it to generate more innovations by carefully examining all the little things that need to be done in a process manner, and then where can they make changes happen to either better serve customer needs or reduce costs or increase distribution and so forth. So let me just wrap with a couple final insights before I turn it over to Erica. One is, just some tips. One is do your homework, right? Anytime you're entering into kind of a new setting, community, problem area, you really got to prepare. You got to learn. You got to do your homework and understand and study. But be observant too. Don't remember the picture I showed you when I asked you what's going on here. Be careful of your filters. Try to observe, factually and partially objectively, not subjectively, but indulge your curiosity. Ask questions, learn, listen. When I take students to Detroit for Duke Engage, for example, I really encourage them to spend their first couple weeks in the nonprofits asking a lot of questions, getting involved in a lot of events, learning, understanding the situation, and then keeping an open mind, knowing that you probably don't have all the answers, and so it's better to collaborate. And know yourself, understand kind of your strengths and weaknesses, how it is that what your shortcomings, your blind spots might be. And really kind of think through a problem in terms of almost the 5 W's and how, like, who's affected, what's happening, where's the problem located, when did it start, why is it happening, how have others tried to address the problem. Unfortunately, a lot of people forget this part. A lot of times you find folks trying to address a problem, they don't realize a lot of other people have been addressing this problem, and let's learn from other innovations, let's learn from other organizations and so forth. One thing I passed as a handout that might be really interesting to you is a big study was just done at Berkeley that was issued a few weeks ago called The 50 Breakthroughs, Critical Scientific and Technological Advances Needed for Sustainable Global Development. I just excerpted a few pages. This whole thing is 600 pages long. But really what they did is they found it in fields from health, environment, energy, transportation, and so forth. What are the kind of innovations that, if they occur, can have dramatic effect on sustainability and development? Really encourage you to, if you're thinking about working in an area, these are some fascinating areas to work on right now. If you're looking for a problem to address, it's worth taking a closer look at. And let me just kind of close up with something from a colleague of mine at University of Utah. He likes to talk about the 10 commandments for social entrepreneurs. Thou shalt not underestimate the commitment of time required to be a successful social entrepreneur. This is not a fly-by-night operation. It takes a lot of time to observe and engage and so forth. Thou shalt not try to save the world, right? We can have modest impact on a very particular problem and not necessarily try not to boil the ocean. We're not trying to find all the issues. We're not trying to solve all the problems. We need to kind of focus, right? And the challenge here is what we're kind of talking about throughout the afternoon is don't doubt the primary constituents' smarts. They may not have a formal education. Like when I talked once with a student about water filters, he talked about their lack of education. But I think it was after the discussion he started to realize that there's all kinds of other cultural understandings about water and access to water that he couldn't even begin to scratch the surface of as an outsider beginning to understand, right? And then some other things, if don't underestimate the time commitment that's required. Know your stakeholders and their topic. They kind of the flip side of the other thing. Always work within the culture, but understand that sometimes you can make change in the culture. Avoid plans that require the primary constituents to invest in infrastructure. In other words, try to develop solutions that don't require huge upfront costs, things that can actually be used quickly, prototyped and so forth is a good thing. Be willing to take risks, but not stupid risks, right? The challenge we often forget about commercial ventures versus social ventures is there's a very real human or social or environmental cost for failure in the social sector. It's not quite as easily chalked up. And so therefore, if you do fail, you really need to learn from it, okay? So there's more information there. The handouts have a lot more information, some resources for you. I put a couple good things in there as well. You can download these online. What I'm going to do is I'm going to take about 60 seconds or so to switch over, and now we're going to move into kind of applying this to global health. And so encourage those of you who are interested in that topic to stick around for another half hour while we kind of apply that. My contact information is up there. So let's go ahead and give maybe 2 minutes for folks to kind of move, and we'll get Erica set up for the global health case. For those of you who do have to go, thanks a lot for joining us, and we look forward to seeing you.